You're listening to the EOE Patient Resources Podcast, the show where we unpack the science, strategies, and stories behind eosinophilic esophagitis. I'm Andrei, and like many of you, I've been navigating life with EOE for years now. Today, we're diving into something that's been a real game changer for many patients, Dupixent.
And I'm Sarah. I'm here to help translate the medical side of things into real-world advice you can actually use. In today's deep dive, we're going beyond just the clinical data. We're talking about what it's really like, to live with Dupixent, the good, the challenging, and everything in between.
It's interesting you say that. I actually started Dupixent myself just a few weeks ago, 5 injections in so far. It hasn't been like a miracle cure overnight, definitely not.
Right.
But I've already seen some surprising shifts. Just the other day, I had 2 bites of pizza dairy, which, used to be my absolute worst trigger, and no reaction.
Wow, that's significant.
Yeah. Still getting some flares, so I know I'm not 100% there yet, but it certainly feels like a big step in the right direction.
That's a really powerful start to your journey, and honestly, it echoes so much of what we hear from the EOE community. I've had the privilege of following hundreds of EOE patients who've started Dupixent, and their success stories are, truly remarkable sometimes.
That's exactly what I want to hear about because, sometimes the official clinical trial data, while it's crucial, it can feel a bit abstract. What does remarkable success actually look like in someone's everyday life?
It's the kind of transformation that really gives people their lives back. We've seen patients who literally couldn't touch foods like chicken or milk for years, suddenly able to enjoy them again after as little as 4 weeks on Dupixent.
4 weeks, that's fast.
It can be, yeah. One parent shared a particularly moving story about their 20-year-old son who, after a really tough 12-year battle with EOE, ate chicken with 0 reaction. And on top of that, his severe eczema, which often goes hand in hand with EOE, completely cleared up. They actually described it as a miracle.
Wow, that sounds incredible. But are these dramatic improvements, common? Or are they more isolated cases?
They're honestly far more common than you might imagine. Many patients who've been on Dupixent for 4 years, or even more, say it quite literally gave them their life back. We've seen clean endoscopy results after just a year for some, which indicates, profound healing in the esophagus.
That's amazing.
And for those who struggled with pills getting stuck, which I know is such a common frustration, many report them just going down with no issues at all anymore.
Oh, the idea of not needing to carry water everywhere or just having a pill go down without a fight.
Yeah.
That truly speaks to a deep improvement in daily quality of life.
Exactly. It's about being able to eat pizza again, maybe, or dining out without that constant background fear, or just navigating social events without having to give those awkward food explanations. These seemingly small freedoms, they really add up to a huge impact.
That all sounds fantastic, but okay, let's address the elephant in the room for many patients. The injection itself, what's the real patient experience there? What are people saying?
Right. This is probably where we get the most candid and consistent feedback. Most patients will tell you it stings at first. It's often described as a burning sensation, sort of like scratching a sunburn right as the medication goes in. But that initial sting usually fades pretty quickly. We even heard from a 7-year-old, actually, who admitted it always hurts a lot, but he was willing to tolerate it because of the expanded food options it gave him, which is pretty powerful coming from a kid.
Yeah, definitely. My own experience so far has been surprisingly manageable. I was pretty nervous beforehand, I'll admit. But I used the pre-filled syringe, not the auto-injector. My understanding and what I've personally found is that the syringe lets you control the speed, which seems to make a big difference in the discomfort.
That's a really valuable insight. The auto-injector is definitely designed for speed and convenience, but that rapid delivery can, intensify the stinging sensation for some. With the pre-filled syringe, you have that option to inject slowly, maybe over 10 to 15 seconds, and many people find that significantly reduces the burn.
For me, the biggest game changer has been making sure the medication warms up properly, like taking it out of the fridge a full 24 hours ahead to reach room temperature naturally. Cold Dupixent definitely burns more.
Yeah, absolutely. That's key.
And then injecting it in my belly, usually at about a 45-degree angle, sometimes with a bit of lidocaine cream or just ice beforehand. Honestly, it makes it barely noticeable most weeks.
That's a gold standard routine, really, and it highlights the power of preparation. Warming the medication, injecting slowly, rotating your sites, using ice or numbing cream. These are all really common strategies patients find effective. And yeah, the belly area is often reported as less painful than the thigh. Establishing a consistent routine can also provide a huge mental benefit.
And I can definitely relate to that. The anticipation the first couple of times was far worse than the actual injection for me. Now it's just part of my weekly rhythm, same time, same spot, sometimes even queue up a favorite playlist.
That routine truly becomes a lifeline for many. And while self-injection is common, it's worth remembering that some patients have a family member help, especially for maybe harder to reach spots like the upper arm. And if self-injection just isn't comfortable at all for you, your doctor's office or a specialty pharmacy can often administer it for you.
It really helps to know there are flexible options. So if someone's first few shots are rough, the key takeaway is not necessarily to give up, right? But to adjust their approach.
Precisely. It's not just about pushing through discomfort. It's about tweaking the process, finding what works best for you, both physically and emotionally. Most people find that the injection quickly becomes manageable and really just a routine part of their life.
That's great practical advice. Okay, now let's switch gears a bit and talk about the science behind this. I understand Dupixent is a biologic, but what does that actually mean for the body and, how is it achieving these incredible results we're hearing about?
That's a great question, and understanding the science can be incredibly empowering. So think of biologics as highly specialized medications. They're usually large protein molecules made from living sources, unlike, say, a broad-acting medication that might just dampen overall inflammation everywhere.
Right.
Dupixent as a biologic works more like a precision missile. It targets very specific components of your immune system.
So it's not just managing symptoms then, it's actually getting at the underlying cause.
Exactly. In EOE, your immune system produces certain proteins, specifically interleukin-4 and interleukin-13, or IL-4 and IL-13. You can kind of think of these proteins as the spark plugs that trigger and sustain that inflammatory fire in your esophagus. That fire leads to the production of eosinophils, those white blood cells that cause the damage.
Okay.
So Dupixent works by blocking IL-4 and IL-13. It essentially prevents that inflammatory cascade from even starting, or at least dials it way down.
Ah, okay. So if I'm understanding correctly, it's about interrupting the actual signals that kickstart this whole inflammatory process, which then leads to reduced inflammation, fewer eosinophils, and potentially even healing of the existing damage in the esophagus.
That's precisely it. And what's truly remarkable about Dupixent is its proven track record now. It's been trusted and approved for a wide range of inflammatory conditions for nearly a decade. It was developed by Regeneron and Sanofi, and its journey began way back with FDA approval for moderate to severe eczema in adults in 2017.
Wow, 2017. That's longer than I realized.
Yeah. And since then, it's steadily expanded its approvals, including its groundbreaking approval for EOE in adults and adolescents, and then, as of 2024, for children as young as 1 year old. This long history means we have a wealth of real-world safety data, which is incredibly reassuring for patients.
That really does make a significant difference for me and, I imagine, for many other EOE patients who might be hesitant about newer treatments, right? That history matters.
Absolutely. This extensive experience means we have over 8 years of real-world use across really diverse patient populations. And throughout this time, no major long-term safety concerns have emerged. And this isn't just about EOE either. Dupixent addresses these core inflammatory pathways that affect multiple systems. So many EOE patients also report unexpected improvements in other conditions like their asthma or eczema or chronic sinus issues once they're on it.
That's truly fascinating. So it sounds like it's really targeting the source of the problem, like you said, rather than just putting a temporary Band-Aid on the symptoms.
That's the core principle, yeah. Dupixent represents a new generation of treatments that move beyond just symptom management to precision-targeted immunotherapy. Its, nearly decade-long history gives us really strong confidence in both its effectiveness and its safety profile.
Okay, let's shift to another big concern for many. What are the actual side effects people are experiencing? What's the reality there?
What's encouraging here is that most patients truly don't experience serious side effects. By far, the most common complaints are injection site reactions, things like redness, maybe some swelling, itching, or pain right where you inject. And these usually improve over time as your body adjusts and, frankly, as you get better at your injection routine.
Right, makes sense. And what about some of the more serious concerns people might read about online, like eye problems or an increased risk of infection?
Those are definitely important to be aware of. Some patients do report issues like dry eyes, itchy eyes, or eyelid irritation, things like blepharitis or conjunctivitis, which people often call pink eye. These are typically mild, though, and can usually be managed pretty well with simple over-the-counter lubricating eye drops.
That?
A small percentage of patients might experience some joint or muscle pain, but this usually resolves within a couple of months. And yes, there is a slightly elevated risk of upper respiratory infections like coughs or sore throats, but serious infections remain quite rare.
Are there any specific warning signs or, red flags that someone should be particularly vigilant about? Things that need immediate attention?
Definitely. Though they are very uncommon, there are serious side effects that require immediate medical attention. These would include signs of a significant allergic reaction, think anaphylaxis, facial swelling, which is called angioedema, widespread hives, or difficulty breathing. There are also rare cases of eosinophilic complications, where white blood cell levels can spike unexpectedly, leading to conditions like vasculitis or eosinophilic pneumonia.
Those sound intense. How often do these truly serious events actually occur in practice?
Thankfully, they are exceedingly rare. I mean, given Dupixent has been on the market for over 8 years now, the vast majority of patients tolerate it very well. But it's always crucial to stay informed and, importantly, communicate with your doctor if anything feels off, especially any new or worsening eye symptoms, changes in your vision, or any persistent joint pain that really impacts your movement.
Okay. What about anything unexpected that patients have reported, even if it's maybe not clinically proven or linked yet? Just anecdotal stuff.
Yeah, there are a few things we hear anecdotally. Some patients have reported getting cold sores, particularly if they have a history of oral herpes. Others have mentioned mild mouth or throat pain, sometimes dizziness or even toothaches, but these are generally manageable. And while there are occasional anecdotal reports of weight gain, this is often attributed to patients finally being able to eat more normally and achieve a healthier weight, rather than a direct effect of the drug itself. And it's important to stress there's no confirmed link between Dupixent and issues like hair loss or cancer.
So the general approach sounds like if something new pops up, even if it seems minor, just let your care team know and let them guide you.
Precisely. Proactive communication with your doctor is absolutely key. And for those milder side effects, simple management tips like using a cold compress for injection site discomfort, making sure you rotate your injection sites, and using those lubricating eye drops can make a really big difference. It's also generally advised to avoid live vaccines while you're on Dupixent.
That's really helpful to know. Okay, so how quickly do people typically start seeing results with Dupixent? Is it like an overnight change or more of a gradual process?
It's very rarely an overnight change, but responses can be surprisingly quick for some individuals. Many patients start to notice improvements in swallowing, maybe food getting stuck less often within about 4 to 8 weeks.
Okay, 4 to 8 weeks.
Yeah, and clinical studies show that by 24 weeks, which is roughly 6 months, a significant number of patients experience really substantial symptom improvement, particularly with dysphagia, that difficulty swallowing.
So maybe about 2 to 3 months for noticeable changes is typical, but it could take longer for some people.
That's often the case, yes. While some might feel subtle shifts in just a few weeks, others might not experience a significant breakthrough until several months in, or sometimes even closer to the 1-year mark. We've actually heard patients describe it as a sudden night and day switch, where symptoms just seem to disappear after a period where they felt like maybe nothing much was changing.
Wow, that's quite a transformation after waiting. So it's potentially a gradual process, but maybe with the possibility of a sudden, dramatic breakthrough down the line.
That's often how it's described, yes. And because individual responses can vary so much, doctors typically recommend giving the medication at least 16 weeks. That's about 4 months before really reassessing your treatment plan. And many patients find that continuing Dupixent long-term, even beyond 52 weeks, brings even greater symptom relief and further reduction in inflammation.
And what about the dosing itself? How does that typically look in practice for EOE?
For most adults with EOE, it's a 300 milligram dose administered once a week. This is usually done at home using either the pre-filled syringe or the auto-injector pen. The really crucial part here is consistency. Missing doses can interrupt the progress you're making, so sticking to your schedule is pretty vital for long-term success.
Right. A question that I know comes up a lot is, what happens if someone stops Dupixent? Let's say their symptoms completely go away. Can they just discontinue it then?
That's a very important question. Dupixent is classified as a maintenance medication. That means it's designed for long-term use to keep that underlying inflammation under control. So stopping it suddenly can, unfortunately, cause symptoms to return, and sometimes they might even come back worse than before.
Ah, okay. So definitely not something you want to just quit cold turkey without talking to your doctor.
Precisely, always consult your doctor first. While there isn't extensive research yet on completely stopping Dupixent after achieving remission, some studies are exploring tapering strategies. For instance, maybe moving to an every other week schedule once symptoms have been stable for a good while, but this has to be done very carefully and under strict medical supervision.
And if someone does stop, for whatever reason, maybe insurance changes or something, can they usually restart it effectively later on if needed?
In many cases, yes, patients can restart Dupixent, and it can still be effective. However, it is worth noting that for some individuals, it might not work quite as well the second time around. So individual responses can vary here, too. It's not always a guarantee it'll be exactly the same.
Okay, good to know. Now let's tackle a very real concern for pretty much everyone, the financial aspect. Is Dupixent expensive? What's the deal with cost?
It's certainly a very real concern, and understandably so. The list price for Dupixent can be around $4,000 per carton, which typically contains 2 doses, enough for 2 weekly injections. But, and this is the critical takeaway, the vast, vast majority of patients never actually pay that full amount out of pocket.
Okay, that's a relief to hear. How is it made affordable for most people then? What are the mechanisms?
Well, for most patients with insurance, their plan covers the majority of the cost, especially once medical necessity is approved. Then there's also the Dupixent MyWay copay card, which many, many patients utilize. It can potentially reduce your out-of-pocket cost to as low as $0 per dose in many situations.
Wow, $0. That's incredibly reassuring. I imagine there's some paperwork involved in getting that approval though, right? The prior authorization.
Yes, insurance typically requires what's called prior authorization. This basically means your doctor needs to provide documentation showing that you've already tried other standard EOE treatments like dietary elimination or swallowed steroids, and that those weren't effective enough for you. Once it's approved, Dupixent is usually dispensed through a specialty pharmacy, and they often help coordinate the delivery and manage your refills, which is helpful.
What happens if insurance initially denies coverage? Is that the end of the road?
And not necessarily. There's an appeal process, and it's actually quite common for doctors to win these appeals by providing additional clinical evidence, things like endoscopy results showing inflammation, detailed symptom tracking logs, maybe allergy test results. Persistence in this process from both the patient and the doctor's office can really pay off.
And what about folks without insurance or those who might face significant financial hardship even with coverage? Are there options for them?
Yes, absolutely. The Dupixent MyWay program also offers financial assistance options for people who don't have insurance or those who are struggling with high out-of-pocket costs, even with insurance. Additionally, organizations like Sanofi Patient Connection and various independent nonprofit foundations sometimes offer grants or other forms of assistance. These programs can truly be a lifeline for uninsured or underinsured patients.
That's a pretty extensive support system.
Yeah.
What's your best piece of advice for someone who's about to navigate this whole application and approval process?
My biggest piece of advice is to start the insurance and assistance paperwork as soon as your doctor recommends Dupixent. Don't wait until you think you're ready for your very first injection. The approval and shipping process can take anywhere from a few days to maybe even a few weeks, depending on your insurance and the pharmacy. So getting a head start can prevent frustrating delays.
Right.
You can usually begin the process through the DupixentMyWay.com website or by calling their support line. And honestly, many specialty pharmacies are excellent at guiding you through every single step.
It's really encouraging to hear about all those safety nets and support programs.
They're definitely there for a reason, and they work for a lot of people. While that list price can feel overwhelming at first glance, with the right support and programs in place, most patients end up paying very little or sometimes nothing at all each month for their Dupixent.
Okay, if you could offer just one overarching piece of advice to someone listening right now who's maybe considering Dupixent, what would it be?
That's a good question. I think it would be this. Try not to let the fear of the injection itself prevent you from trying a medication that truly has the potential to transform your life with EOE. I've heard from countless patients who hesitated, sometimes for years, solely because of injection anxiety, only to find it far more manageable than they ever anticipated once they started.
What's the most common sort of emotional pattern you observe in patients who do start it?
It's almost universally an initial nervousness, maybe some anxiety, that fairly swiftly transitions into just deep gratitude. Gratitude for finally having their life back, for being able to eat without fear. One parent even said something like they'd go bankrupt to keep their child on it, just given the profound improvements they'd witnessed. It can be that impactful.
Wow. Based on all that patient feedback you've heard, what are some specific practical things people wish they'd known before starting Dupixent?
Several key insights come up repeatedly. Number one, let the medication warm up longer than you think you need to. Really let it get to room temp. Number two, the belly is generally less painful for injections than the thigh for most people. Three, it's absolutely okay to inject slowly. Don't feel like you have to rush the process.
Right.
Also, keeping a simple food diary can be really helpful, not just for tracking triggers, but for tracking your progress and celebrating those small victories along the way. And critically, probably the biggest one, don't expect overnight miracles. Give it the time it genuinely needs to work.
That's good advice. Any specific techniques or strategies people use for dealing with that initial injection anxiety?
Absolutely. Practicing relaxation techniques, like simple deep breathing exercises before and during, can be very effective. Some patients find distraction works well, listening to music, watching a favorite TV show clip during the injection. Others find that building a simple reward system helps, maybe like a special treat or a relaxing activity they look forward to after each weekly injection. Whatever works for you.
And for those who love to travel, is it actually feasible to take Dupixent on the go? How does that work?
Oh, it's entirely doable, but it definitely requires some planning ahead. You'll want to carry a letter from your doctor explaining the need for the medication, keep the Dupixent in its original packaging, and use a specialized travel cooler for longer trips to maintain the proper temperature control. Many patients successfully travel all over the world with their Dupixent.
Okay, let's broaden our perspective a bit as we get towards the end here. What does life actually look like for individuals who've been on Dupixent for an extended period? What's the bigger picture?
The overwhelming consensus, really, is that Dupixent is genuinely life-changing. And for many EOE patients, it can even feel life-saving. While, yes, there's that brief injection sting and the potential for minor side effects, the ability to eat normally again, to socialize without fear, and often to achieve clear endoscopies makes it profoundly worthwhile for the vast majority of people who stick with it.
Is it generally something people stay on indefinitely, or can some eventually stop treatment? What's the long-term outlook?
That's still an area of ongoing study, to be honest. We know some patients do maintain improvement even after stopping, while others seem to require continuous treatment to keep their EOE in remission. We've also seen some patients, particularly those who've been doing really well for over a year, successfully transition to an every other week dosing schedule under their doctor's guidance. So it's becoming more personalized over time.
And what about combining Dupixent with other treatments? Is it often part of a broader strategy, or is it usually used alone?
Yes, absolutely. It's often part of a broader strategy. Many patients continue with some level of dietary modifications, maybe avoiding their absolute worst triggers, or they might continue using acid-reducing medications alongside Dupixent. It's not necessarily an either situation. It can be a highly effective component of a comprehensive treatment plan that's tailored specifically to your needs and your history.
Are there any long-term monitoring aspects or ongoing concerns patients should just generally be aware of as they continue treatment?
Dupixent has a good overall long-term safety profile based on what we know so far. But like any long-term medication, ongoing monitoring is just part of the process. This typically involves regular checkups with your doctor, maybe occasional blood tests just to monitor general health markers, and usually follow-up endoscopies at intervals determined by your doctor to assess the healing of your esophagus directly.
Okay, so for someone listening right now, maybe feeling overwhelmed by their EOE, perhaps they've tried diets, they've tried steroids, when is the right time to seriously consider Dupixent with their doctor?
Generally, it's recommended for patients who haven't responded sufficiently to those more traditional treatments like dietary changes or swallowed steroids. Your doctor will really assess the severity of your EOE, look at your history of previous treatments, what worked, what didn't, and consider your overall health to determine if it's a potentially good fit for you.
What if dietary elimination diets did work for someone, but they were just simply too restrictive to maintain long-term, living on just a handful of foods?
That's exactly the kind of situation where Dupixent can be truly transformative. If you find yourself living on a highly restrictive diet, maybe only 5 or 6 safe foods, and it's significantly impacting your quality of life, your social life, your mental health, Dupixent might be the key that enables you to safely reintroduce foods and regain that dietary freedom, which is huge.
And what are the most important questions someone should be sure to ask their doctor when they're having that Dupixent discussion?
Oh, definitely. I'd suggest asking things like, Based on my specific situation, my EOE presentation, what's the likelihood you think I'll have success with Dupixent? How will we monitor my progress? How will we know if it's actually working? What's our plan for managing any potential side effects if they pop up? Realistically, how long might I need to stay on this medication? And what's a typical timeline for me to start seeing noticeable improvements in my symptoms?
That's a great list. Okay, let's try to set some clear expectations for those crucial first few months. What should someone anticipate in terms of a timeline and how they might feel?
Okay, so in the very first month, you might experience some initial fatigue, maybe some of those injection site reactions we talked about. However, many patients do start noticing early improvements in swallowing. Sometimes as soon as week 2 or 3, maybe food just goes down a little easier.
Right.
Then by months 2 to 3, most people who are going to respond well report significant improvement. Swallowing becomes noticeably easier. Food feels far less likely to get stuck. Things just start feeling better.
And what about looking out towards the 4 to 6 month mark? What happens then?
By that point, continued improvement is very common. Your doctor might schedule a follow-up endoscopy around this time to directly check on the healing inside your esophagus. Many patients report feeling truly normal again with their eating by 6 months, really rediscovering the joy of food without that constant anxiety. And beyond 6 months, sustained improvement is the goal, and some patients even achieve complete histological remission, meaning the eosinophil counts are normal, which is the ultimate goal.
It's really good to have that kind of roadmap. Are there any, okay, and for the more common but still concerning side effects, when should you call about those?
For those, you should generally call your doctor within about 24 hours if you notice persistent injection site reactions that seem to be worsening significantly after 48 hours, any new or worsening eye symptoms, even if mild, like persistent dryness or redness, or unusual levels of fatigue that don't seem to improve after your initial few doses. It's always better to be safe and just discuss it with your care team.
What kind of support and resources are available for people who are just starting out or maybe just considering Dupixent? Where can they turn?
The Dupixent My Way program is really a fantastic central resource. It offers comprehensive patient support, help navigating insurance, financial assistance programs, and even nurse-led injection training if you need it. You can find loads of information on their website, which is dupixentmyway.com.
Perfect. Any final advice for someone who might still be on the fence about trying Dupixent? Just a last thought.
I'd say have realistic expectations about the initial injection discomfort. It's real for many, but try not to let that possibility deter you from exploring its potential for dramatic, life-altering improvement in your quality of life. Remember, every single patient's journey with EOE and with Dupixent is unique. Try really hard not to compare your progress or your timeline to others you read about online. It takes time. Consistent communication with your healthcare team is absolutely paramount, and please know that support is readily available every step of the way. You're not alone in figuring this out.
This whole deep dive has been incredibly helpful. Seriously, I feel like I have a much clearer, more realistic picture of what Dupixent could mean, not just for my life, but for others navigating EOE too.
That's exactly what we hoped for. The decision to even consider a new treatment like Dupixent shows you're actively taking control of your health, which is commendable. And while those injections might seem daunting at first, honestly, most patients really do find they quickly become just a manageable part of their routine.
Yeah. For anyone listening who's considering Dupixent, you're absolutely not alone in this journey. There are literally thousands of patients who have successfully used this medication to regain control over their eating and really over their lives.
Focus on that powerful goal. Eating without fear, truly enjoying meals again with family and friends, and just living your life to the fullest potential. Your healthcare team, your doctor, nurses, pharmacists, they are there to support you every single step of the way.
Don't hesitate to reach out to them with questions, any concerns you have, or even just to share your progress, the small wins. Whether you ultimately decide Dupixent is right for you or not, the important thing is that you're exploring all your options with an informed perspective.
And remember, you don't have to do this perfectly. There's no perfect patient. You just need to approach it consistently, make sure you have the right support lined up, and have compassion for yourself throughout the process. It's a journey.
That's it for this deep dive into Dupixent on the EOE Patient Resources Podcast. I'm Andrei.
And I'm Sarah. Thanks so much for spending this time with us. Until next time, stay safe, stay strong, and remember, you absolutely can thrive with EOE.